Welcome everyone to our Survive and Thrive virtual experience. This is our week 2 Monday presentation. I'm Rachel Perkins, the Education and Outreach Specialist for Texas Oncology. If you're a cancer patient, caregiver, or professional and want to educate yourself about the cancer realm, we invite you to join us on Mondays at the same time we have one more presentation after this. We're so glad to have you all with us today, and we're excited to hear from Erin Dean, and she has a presentation on sexual health, revitalizing your sexual health with cancer. So just a little bit of a foundation intro. The Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. Through Survive and Thrive programming, the foundation can provide educational events and resources to help build community connections and support all affected by cancer. Now we have the pleasure of learning and listening to Erin Dean. If you want to go ahead and introduce yourself, Erin, we would love to get started.
Okay. Hi, I'm Erin. I live in Austin. I work at Texas Oncology. Been there for about 5 years. I think my son is calling my name. I told him that I'm not going to be available, but sorry if that happens. I'm a pelvic floor physical therapist, and I also am a sexuality counselor. So that means not a sex therapist, but basically someone who has a pretty good extensive knowledge in sexuality and talking about it with people. And so we're going to talk a lot about both of those things today. So today we're going to talk about basically your sexual health and revitalizing it under cancer treatment. So with cancer treatment, after cancer treatment, no matter where you're at during your journey, this talk is for you. So the first part is for people with vulvas and their partners, but we discuss some issues affecting people with penises later on in the talk. So if that's you, you're not getting left out. It's just most of this information has to do with really medically induced menopause. So the 4 main things we'll talk about today are painful penetration. So that's sexual penetration, sexual desire changes, body image changes, and relationship changes. So we'll go into a lot of detail on this. I have a lot of patients who come to see me for painful sex, penetrative sex. And there are a number of reasons that cancer patients might be having this. So their ovaries may have been removed prematurely. Certain chemotherapy drugs can cause basically you to go into menopause and then have this painful penetration all of a sudden. Radiation to the pelvis, especially brachytherapy. So that's when they're irradiating the tissue inside the vagina. That's really commonly causing pelvic pain. And then estrogen blocking therapy. So a lot of people with breast cancer, kind of towards the end of their treatment, they end up with some estrogen blockers. So anastrozole, letrozole, tamoxifen. These basically reduce the function of your ovaries even further. So there's less estrogen in your system. So if you've already gone through menopause and you're on one of these first 2, it kind of increases those symptoms that you maybe had experienced initially. If you haven't gone through menopause, then the symptoms are usually more severe because the onset is rapid. It's also, it's just a lot at once. So, and we'll talk about kind of that unfortunate road to painful penetration. I'm actually going to change this just a little. There we go. Okay. Yes, let's go away. There we go. All right. So this is the most common progression that I hear people tell me that they've experienced when they have painful sex. So first, their vaginal tissues may become less moist and supple because of chemo, this estrogen therapy, or radiation. Okay, so all of a sudden, the tissues themselves are maybe a little bit thinner. There's little micro tears in them. And then they have sexual intercourse for the first time after treatment or during treatment, or they have their first vaginal exam and it hurts a lot. And so then they have this guarding reaction because there's this pain and it's in the vagina, which is especially emotionally upsetting. And then that can lead to fear of damage, And also they just don't want to have it again. So next time they try to have penetrative sex, there's guarding in the muscles, and that guarding leads to more pain. And then pain combined with hormone changes can demotivate and make you not want to have sex, because yeah, we'll talk more about that, but the desire is greatly, you know, pain can definitely decrease desire for obvious reasons. There we go. So what do we do about it? There's a lot of things. So this website, by the way, at the end of this talk, the last slide is, or the second to last slide is a bunch of bullet points with all of the resources that I reference. So you don't have to like write them down. You can maybe wait till the last slide and take a picture. But sexualityresources.com, A Woman's Touch is a really good place to go for a lot of free information. So they actually have, they've got a lot of little pamphlets that you can download. They have a lot of resources on great lubrication or lubricants and toys to use. The lubricants are all, you know, they have all of the good things in them and none of the bad things in them. So they're all safe. Anyway, so that's a really good resource. So some things that people will use or that will suggest to treat are external estrogen cream, so estradiol usually, and or suppositories. So these are, you have to get your oncologist okay to get this estrogen cream, but all the research is showing right now that this is safe for pretty much every breast cancer patient and a lot of gynecological patients. So I have people who come in, they haven't started on estradiol cream, and then they have painful sex and pelvic pain and maybe pain with urination and higher chances of getting a UTI. And then they get on this estrogen cream and everything's much better. So it doesn't get into your bloodstream, the research is showing, and it's safe for most people, okay? So ask your oncologist if it's okay for you. But that's a really helpful one, I would say. If you can't get on estrogen cream, maybe you have cervical cancers or another gynecological cancer that's estrogen positive, and your oncologist says no, there are still a lot of other options. So hyaluronic acid based suppositories and creams like Reverie or Replens, you probably heard of those. Those are really helpful. So basically when that's a suppository, and then it'll kind of, the cream will be on the vaginal canal and come out and get around the vulva too. That increases your tissue's ability to retain water and moisture. So I would say that alone usually isn't enough, but that plus moisturizing lubricants can be a great combo. So you would use the Replens, I think it's twice a week, and then you would get a lubricant. And people always ask me like, wait, like lube is just for day-to-day use? And it is, because so there's these hybrid lubricants, and this is on the sexuality resource page too. There are 3 that I highly recommend. They're hybrid, meaning they're silicone and water-based. They don't have any of the bad stuff. They have all the good stuff. And what they do is the water-based part, it moisturizes the tissue, and then the silicone-based part seals it in. So Oasis Silk is a good brand, Sensuva Hybrid, and Sliquid Organic Silk. It's the green label. You can get these for like $20 on Amazon, and they will last months and months. So it's not as expensive either as some of the other products out there. And you just use that all around the vulva after a shower every day. That's what I tell people. People with a lot of pain and maybe pain with urination, they can use it after every time they pee. The tissues will still slowly start to heal, and they'll have to use it less often. Okay. Another one is external vulvar and internal vaginal manual techniques. So on this website as well, there's a whole pamphlet for their vaginal renewal program. Shoot. I have a brochure. Yeah, I think that's what it's called, vaginal renewal program. yeah, anyway, step by step how to do this. But the basics are you're bringing blood flow to the vulva. So when I say that, I'm talking about all like the external labia, the internal labia, the hood of the clitoris itself, that base of the vaginal opening, all of that tissue gets brittle and dry, you know? So having that lubricant, and then you can actually do just some like rolling, massage. There's different things with your fingers that brings blood flow, and blood flow helps to kind of rejuvenate the tissue. It's a loss of blood flow that's causing the tissue to become brittle. So internal techniques, there's this pelvic wand right here. This is an Intimate Rose product, which I really love. It's kind of scary looking, but it's silicone, and they make one that vibrates. It's about $50. It's got a weird shape because if you imagine this is the vaginal canal, you're going in and then you have to go slightly down and over to get to those, usually the muscles that are painful for people who've been guarding for a long time. So you can actually use it, and you can kind of mobilize the tissue, and then you can kind of get, if you have any little painful spots, you can hold on it and you're getting blood flow. The vibration is bringing blood flow to the area too. So you can use this side and just sort of work all around the internal vaginal canal with that lubricant and the vibration to bring blood flow. Bonus, you know, if it feels good and you want to have an orgasm, that can increase blood flow too. So, you know, sometimes that's fun. What was I going to say about that? Oh, that's right. So if there's pain, if you're doing this and it's like, that really hurts, or it's this burning sensation, there are some techniques. And if you come to see me or another pelvic floor PT because this information isn't enough for you and you're still having pain, we will find the technique that works for you. I'm just going to give one option right now. So the idea is if you have those muscles and they're guarding, you want to be able to soften them. And sometimes it's actually the muscles guarding that cause that external part to hurt and makes it burn. So people, it's kind of hard to understand that sometimes that burning sensation with penetration is because your muscles are guarding. Okay, so how do you know that? You use either a small little vibrator that you have on your own already, or something like this, and you test it out. You know, you insert with your good lubricant, insert. If it hurts, can you soften the muscles and the pain go down? That's a really great moment, because then you realize you have some control. So on this next slide, we'll talk about one of the things you can do to decrease that muscle tone in your pelvic floor. So if you can if you're sitting, just relax back into your chair so your stomach can relax, and put one hand, if you're okay with it, on your chest and the other on your low belly, and relax back, maybe even slump a little bit. I don't know if you can see me because I can't see myself. So you're going to, the idea is with this breath technique, you're not breathing into your chest like that. So instead, you're relaxing your stomach, letting your gut stick out, and inhaling, letting your belly rise. As you exhale, the belly falls. Mechanically, what happens is when you are, let's see if I can see myself. I'm going to stand up. Hand here, hand here. When you are inhaling into your belly, the diaphragm and the pelvic floor move together. So when you're inhaling, the diaphragm moves down, the pelvic floor moves down, which is a softening, opening motion. As you exhale, it comes back up. So you inhale, let your belly get big. Your pelvic floor drops. You got to let it drop though. Exhale. Come back to neutral. Let's try it one more time. Inhale, belly big. Pelvic floor drops towards your feet, almost like you're thinking about maybe letting your pee go, and then back to neutral. Okay. All right. That for some people, that doesn't make any sense and it's very challenging. I have them try it at home for a while in a place where they're not having me watch them. And really the idea is if you can get to where you can feel the motion downwards of the pelvic floor, that's the aha moment. If you're using your wand and there's pain, can you get that opening, softening of the pelvic floor and the pain goes away or goes down at least? Proves to you that you're actually possibly going to regain some control over this. Okay. Okay. So just a quick note about radiation. So radiation itself can cause the vaginal canal to shorten, and it makes the tissues kind of, if this is the vaginal tissues, it makes it kind of get tighter like that over time. So it can become more narrow and shorter, and the skin can become more friable or brittle, sort of like we discussed before. And this can lead to difficulty with future exams and also pain with sex or penetration. So what do we do about it? After you get brachytherapy or pelvic radiation, a lot of the radiation oncologists will give you some dilators. Most people don't like them. They're plastic and weird. They sell the Intimate Rose is that, again, that brand is really good. They sell these more pleasant looking dilators, and you can get like the 4 smallest ones, or you can get the 4 largest ones, or you can get the 4 in the middle, or you can get all of them, and they're silicone just like this, but they're more mobile. If the plastic ones that they give you for free freak you out, then I would, and you can afford it, I would try to invest in some other dilators, because if you don't dilate the tissues after radiation, they will shrink. So the protocol is 3 to 4 weeks after radiation is over, you want to use these dilators. So you're inserting it. If there's pain, use the breath. You insert it, you hold it in place. You can move it around a little once that becomes pain-free. And you're trying to maintain whatever canal length you need. If you have a partner with a penis, then maybe the size of that person. If you don't have a partner and all you need to worry about are vaginal exams in the future, then you would likely need a smaller size. So you hold it in place 10 minutes or so, 2 to 3 times a week, or intercourse also works. And this is for some people lifelong, unfortunately, but most people do find that after a year or 2, they don't have to do it as often or at all. Yeah, I was going to say something else about that, but okay, here's one thing about radiation. I have a lot of patients tell me that they're afraid they're going to hurt themselves if they stretch out the skin or if they have intercourse. So if you fear sex due to pain and because you're afraid you're going to hurt your tissues, this is what you do. You go slow. If it's a partner with a penis, you have them move slowly. You pause and do your breath technique. If you have pain, see if you can make the pain go down or away. And then you're kind of guiding them. You're not there, you're in control of this whole situation. Use plenty of lubricant, moisturize daily, like we talked about. Your tissues will be okay. So they give you dilators after pelvic treatment, radiation treatment, because it's safe to use them. So it's safe to have something in there at that point, 3 to 4 weeks after you're done. It just, so the fear can cause more guarding. So just remember, you're safe, go slow, use lubricant, use your breath, your tissues will be okay, right? Okay. So now I just want to talk about sexuality. All right. So we kind of went through the logistics and pelvic pain and the PT side, and this is a little more about libido and sex and how that changes with cancer. Rachel, are we going to do questions at the end? Is that the idea?
Yeah, we can do questions at the end, or I have a couple now too, whatever you'd like to do.
Okay, maybe let's do two questions, or yeah, those two now,
Okay.
and
So
then
the first question was just like, will tonight's session focus on women only? And I think you answered that at the beginning, but I'll go ahead and let you answer that again.
yeah, so this next section will have more, this is more about people with vulvas, but there's some here at the end about people with penises too, so.
So, and then I did have someone who wanted to know the specific names of the moisturizing lubricants that you mentioned. I know you said a hybrid, but I just wanted to see if you had a specific one.
Okay, yes. And I'm sorry, but this isn't on my resource list, although it is on that website that's shown right here, which is on the resource list. But okay, got your pen?
Yes.
Oh, okay. Oasis Silk. I've never used that one, but a lot of my patients love that one a lot.
Okay.
Another one's Sensuva Hybrid. Oh, you're typing it? Thanks.
Yeah.
Okay. And the last one is Sliquid. It's Sliquid, Organic Silk, which is the green label.
Okay. All right. And that is our questions for right now.
It's for now. Okay. All right. So if y'all are okay with it, I mean, I can't actually see your faces anyway. So feel free to close your eyes so that you can get into your own body. But I wanted to kind of remind you of something. Okay. So you went through or are going through something so hard. It can be incredibly scary. You might feel a loss of control, and things are happening so fast and happening to you. So everything's changing, your body, your energy levels, possibly your view on life, your priorities, and your role in your family, your ability to enjoy certain things. This is really hard. So even if you're done with treatment, the effects can last months and even years. It may not have seemed as essential for life during your treatment while you were in survival mode. But sex and sexuality might be something that it's important for you to get back to at this point. So if you're ready, and if sexuality was important to you before, it may be a part of growing back into your vitality and your power and your sense of aliveness, your creative energy and your survivorship. So you may or may not have been very sexual in the past, but with a shift in priorities may come a shift in your sexuality. So our sexuality can change many, many times throughout our lives. And this is one change. You get to choose how to go forward from here. Okay. You can open your eyes. So let me talk a little more about all of this. So like I said, it's sexual desire is inevitably going to change because of cancer treatment, at least for a while. So libido is fragile. It's negatively impacted by stress, sickness, menopause, distraction. Feeling desire for sex can be compared to feeling playful and curious. So if we're exhausted or living with fear, it's hard to feel playful and curious, right? And like I said, libido changes many times throughout our lives. So at some point, everyone is going to have to kind of learn something new and spark their libido if that's continues to be important to them in their kind of relationships. So this is how you do it. So sparking intimacy, here's a couple of, we'll go through each of these separately. So maintaining intimacy during treatment, we'll talk about. We'll talk about grieving your cancer and then reconnecting with your body. We'll talk about how to reset or work with this new body that you have and your sense of self. We'll talk about working on your intimate connection or connections. Something called Other Course, which is also in that on the website, the sexualityresources.com pamphlet on that. And Good Enough Sex, which is a model we'll describe. So during cancer treatment, it's very helpful if you make time for physical intimacy with your partner or partners. So touch, cuddle. I have a lot of people tell me that they are afraid that if they touch their partner or allow for kissing or something, that their partner is going to want sex, and sex hurts, or they don't really want sex because they're exhausted or whatever it is. So then they end up not touching their partners, and that further divides them. So I suggest just take it off the table. Just say, you know, have that discussion, which can be hard with your partners, and say, sex hurts me now, or I really want to be close to you, but just sex or really whatever you don't want to do is too much for me. Can we just this or that or the other without that pressure or feeling like something else has to happen? So having that conversation can be really, really helpful. And it can, in some cases, actually, you know, if you're in the right place with your treatment, or if it's after treatment, it can actually be the thing that gives you permission to now kind of get aroused again, because you're finally kissing again and you don't feel like you have to do it. It doesn't mean anything. You're just kissing because you want to kiss. So anyway, that's really helpful. So also talking to your partner or partners about what you're feeling and what they're feeling. So oftentimes the person who's not going through treatment, you know, they're having a lot of feelings too, but they feel like they should keep it quiet because they're not dealing with cancer. So it's not about them. But talking about what both or all partners are dealing with is really important and hard. I acknowledge this is all very challenging to do, but it can strengthen your relationships. So the second thing is first grieving and then reconnecting to your body. So treatment may make you feel as if things are happening to your body, make you feel a lack of control, checked out, or that your body betrayed you. Something I hear a lot. So grieving means taking time to allow for the feelings. So feeling what you feel, and something that especially if it's related to a change in your body. I have a lot of breast cancer patients who've had mastectomies tell me, you know, they can't necessarily feel their new breasts, or they're flat now. And they don't even want to touch it because it makes them mad or whatever. But that feeling, those feelings of anger or disgust or sadness are important to feel, or they stay in you. So I suggest just closing out everybody, shutting the door, locking them, and touch your own body, your new body, whatever is different, the scars, you know, it might be something deep inside your body that's different. If you had, you know, rectal cancer or gynecological cancer, touch that area and just allow yourself to feel whatever it is that's coming up. And it might be a lot and you might sob, but that's in the end better than not feeling it ever, because that's when it gets stuck in you. So you really have to grieve at some point if you want to really reconnect to your body. So remember, the body didn't betray you. The cancer grew against your body's will. So hate the cancer, not your body. Okay. And then notice pleasure. So this one's a wild thing for people who've gone through cancer treatment. I even have people write it in their calendar. If they look at their calendar every day, notice pleasure, notice pleasure, notice pleasure. All that means is, as you're going through your day, pleasure is different for different people, but it might be, oh, I'm on this walk and I'm noticing how the sun comes in through the leaves and the leaves are shining. Instead of your brain seeing that and complete, like losing out on that moment of pleasure, remember that you're trying to pay attention to it. So notice it, stop maybe for 3 seconds or 10 seconds and look at it and feel that in your body. If there's a breeze that is nice, not like today maybe, but a nice, cool, pleasant breeze on your face, instead of feeling it and then continuing to think about whatever you're thinking about or looking at Instagram, feel it and enjoy it. Okay. The smell of something being cooked, if you can, you know, if that can be a really good one. There's something really good being cooked in my house right now. It smells like ginger, garlic, sesame oil. I can not notice it, which I didn't until I said that, or I can pay attention to it, and that's pleasure. So we kind of disassociate from our bodies during cancer treatment. And honestly, a lot of us do this in life anyway. And it's hard to, you don't think that you're not allowed to have pleasure anymore. There's nothing that's pleasurable in life, but there are these little things happening all the time if you pay attention. And then there's an exercise, one more that I'd like to try with y'all. So your body's response to stimulation has likely changed. Maybe you don't have as much sensation in places, or something's hypersensitive. And so here's a little quick exercise called waking up your hands. This one's really, really fantastic. So the website's on the left there, and it'll be on the last slide. So this is an activity to learn how to access a state of relaxed pleasure. So if you can just look around your space and find any object, maybe something that's soft, if there's something soft next to you. I'm going to use this because that's all I've got, but it's kind of soft, so that's cool. And I would put it in your lap, let your arms rest in your lap, and close your eyes. So start by just noticing this object in your lap. And then run your fingers along it. And notice how fast you want to move. Slow down, move half that speed. So notice all parts of that object, the corners or the outside, kind of if it's smooth or rough in different places. Just take about 30 seconds and pay attention to what you feel on the object. You can look down too if you want to kind of see what you're feeling. So then notice the pleasure that your hands are experiencing. It might be really pleasant. Maybe focus on a spot that's particularly pleasant. Hang out there. And then as you have that pleasant moment, notice the feelings that come up about feeling that pleasant thing, having pleasure, feeling pleasure. What do you notice about what feelings come up? So sometimes people might be surprised. There might be some sadness, self-doubt, or even shame sometimes. So just pay attention to what you feel. So you can stop. This might be easier to do when you're not kind of getting talked through it by me or being in this group. And it takes practice. So if there were any sparks that kind of came up for you or things that were interesting, then I would just go to that website and try it again. There's a video where she talks you through the whole thing. So it's the baseline really for being able to reignite libido, desire, and arousal. Noticing pleasure in your body and then allowing for the good parts of that pleasure. Okay. All right. I know this can be a lot too. I gave this talk in person at the Texas Oncology Foundation Survive and Thrive conference, and there were a lot of tears. So it's okay if this is a lot for you. I want to talk about So body image, that's a big one, especially with breast cancer patients, but really anyone with these new scars or an ostomy bag or all kinds of new different parts of your body. So Emily Nagoski is she's an educator, sexuality educator, and she wrote the book Come As You Are, which is also on the resource list. It's amazing. But she suggests change how you see, not how you look. She gave an example, look in a mirror and say and mean it, she, he, they are so beautiful, are a warrior, are strong. Whatever it is you need to hear. I know for me, this sort of seems corny at first, but then when I did it, I got welled up. So it can be powerful, all right? So can you see your scars or your ostomy bag or your new waistline as a rite of passage into a new, wiser state of being? You know, look what I've gone through, look what I've survived. And it's the partner's work to learn to love the new normal. So their partner's new normal, and express this. So that's so important for the partner to express their love of this new normal. But really, it takes you loving your new normal. You know, if you don't love your new normal as much as anybody says that you're beautiful, you probably don't believe them. Other suggestions: consume media, including people with bodies like yours. So, and who are thriving, okay, and loving themselves. So follow these people on Instagram, Facebook, watch these shows, watch these movies. It is so easy to overconsume media with the picture perfect, whatever we decide is the right body for this time in our, you know, cultural experience, and then to think that we're below that or not enough. So change what you watch, change what you consume. You know, Instagram, they'll give you suggestions based on the things that you already are watching or looking at, right? So you can start kind of this trend of seeing more of these positive things. Another thing, buy a new piece of lingerie. That seems simple, but it can, for your new body, right? So find something that makes you feel good in your new body. Might be different kind of style than you felt good in before, but you might even wear it under your clothes and your partners don't know. So it's for you, right? It's for you to feel sexy. It's not necessarily about them at first, right? And another great book is called The Body Is Not an Apology by Sonia Renee Taylor. So that book I have on my desk at work, and it's, there's a lot of like social norms, what we're expected to look like and be, and kind of how to change that on a societal level, but also in your own self. So that's a great book. Can I get through everything in 7 minutes? 1, 2, 3. I think I can. Okay. Work on your intimate connection. So we kind of talked a little about this, different roles that the two partners, if there's two, play, and how that dynamic can be tricky if you stay in that dynamic forever. So try to change it. Start by trying to do something novel or exploring together. Like start creating a new narrative, basically, for your lives together. Get back to your sex life in a new way. So talking about sex, maybe reading some books or podcasts together about sexuality, and kind of growing together. You might have been stuck in some old patterns anyway, so it might be time to grow, and this could make your sex life better than it was before cancer. So there's a study on optimal sexuality that says that communication is essential. So the study is called From Closet to Reality, Optimal Sexuality Among the Elderly. It's a study on people over 60 in relationships, 25 plus years, who self-report optimal sexuality. It suggests that optimal sex evolves over time. It flourishes when the relationship deepens with maturity and personal growth, right? And it's not goal-oriented, but rather focused on pleasure and exploration with humor, okay? So this little card set over here is called it's called Best Self Intimacy After Dark. Fantastic. If you need kind of a starting point, you're like, I don't know how to talk about sex. I don't know what we're supposed to do that's different. That's got a lot of options for you. And it's kind of a play-by-play how-to. So you also might have responsive desire now instead of, I always forget the other one. Responsive and spontaneous. Anyway, so maybe before you spontaneously would feel, turned on, and now more likely you won't be turned on like in a physical sense until someone else turns you on, right? So that's okay. That's normal. It's normal after menopause, honestly. So you might need someone else to initiate, and that's normal. And you might need more physical stimulation before becoming aroused. So it might need to go slower, and talk about that with your partners. So explore on your own what feels good in your body and then tell them, okay? All right. Other course is, again, sexualityresources.com, another pamphlet. So what is sex? Is it penis and vagina? What about people who don't follow these gender roles? What about people with different anatomy? Or what about people with difficulties maintaining erections? People with changes in their vaginal tissue or other pain in their body. So other course is a term describing all of these other sexual acts beyond penis and vagina. It's using body parts or other objects to create sensation on the other without penetration. So that's the key. It's pleasurable and it's creating sensation. Pleasure to different people means different things too, right? So explore that together. You're playing. There's no goals. No goals. That's the most important part. Because who wants, this scripted, this has to happen or this is unsuccessful? Like that's just, it's a losing battle eventually in life for that to be necessary. So it can just be pleasure and fun and laughing and exploration. And that's it. So sometimes the best sex has no penetration and no orgasms. It's true. So the good enough sex model is another model out there in the world. The focus is on sharing desire and satisfaction rather than individual sexual performance, rather than on passionate sex or orgasms. So traditional male sexual socialization values easy, predictable, autonomous sexual desire and function. So what does that mean? Spontaneous arousal, erection, orgasm. So as men age or deal with illness, this societal standard becomes self-defeating and destructive. So the good enough sex model, there's again, no goals, no pressure to even be turned on. That one's wild for people. Because that's the pressure to be turned on ends up not turning you on. So that's why I said earlier, take sex off the table and just kiss, and you don't need to be turned on to kiss. You're just trying to connect. And then maybe you'll get turned on. Maybe. So get away from the sexual script and the baseball game. First base, then we go to second base, then we go to third base, then we hit a home run. Like you've done that 5,000 times in your life or more, switch it up a little. It'll be fun. You remember the times when you first started like exploring without having penetrative sex, and you would do all these things for so long and it was so much fun, and you're kind of exploring each other's bodies and what feels good. That's what we're kind of talking about here. So how do we do it? A lot of endless iterations. So that the card deck that I talked about before is a really good one. Change the script, get away from that baseball diamond analogy. So play a game. Simon says, do this to me, and then do that to me. And they start doing it. And you're like, Simon didn't say, that can be fun. So start with a different body part than you normally do. You never know there might be some body part that you and your partner who've been together for 4 decades didn't realize was erogenous. And then all of a sudden you find this out because it might have changed. Especially if I have patients they don't have sensation in their breasts. They start to explore on themselves and they find their belly is just so sensitive. And they were thinking about getting a deep flap. And they love the fact that their belly's sensitive. They decided not to get a deep flap. because that would make the sensation in their belly go away too. So have kissing only nights, kind of like we talked about before, which you did when you were young probably, and that was so much fun, right? Use a toy. Toys, there's so many toys out there, and people have, there's based on your what you've determined society says is or isn't okay, your religious background, your family dynamic. Toys for some people are kind of like taboo or scary, but especially as you get older, especially after menopause, or especially when erectile function is reduced, toys can be really helpful. So to bring that extra stimulation that you need in order to have more pleasure and maybe an orgasm. Also, side note, erectile function, when you're in your 50s, 50% of the time you're going to have normal erections on average. When you're in your 60s, 60% of the time, sorry, I made that sound backwards. 50% of the time you're going to have difficulties with erection. In your 60s, it's 60% of the time you have difficulty. 70s, 70% of the time. So that's normal, right? Bring a toy into play. Lots of toys out there. Let's make it fun. Deck of cards, and yeah, just basically trying to have fun, feel pleasure, play with sensation, no goals. Yeehaw. That's the end. Here's my resource page. So take a picture if you'd like to. And after a second, I'll switch down to my personal information. If you need there's all my info there if you need to come see me. I am open to questions now, and I wish I could see all of you. I can't see anybody, and I hate it.
That's
okay. What do I do?
If you want to stop sharing your screen or just keep this up for a second so people can take a photo, we'll go ahead and get started with questions. But Erin, I just wanted to say thank you so much. Every time you do a presentation for us, I learn something new. You are invaluable to the foundation, and I'm so thankful that we got to hear from you today. So thank you. We had a participant who asked a question, and they said, I noticed when I took a high dose of ibuprofen for something unrelated to cancer, it was a slip disc, my pelvic floor read a lot less tight on the machine my PT uses. Is that common? So ibuprofen before sex, is that a thing?
So ibuprofen reduces inflammation. So if your pelvic pain was due to an inflammatory process, then that would make sense. But usually that's only the case if there's maybe like a hormonal thing. More often like endometriosis or something can cause some inflammation that might be reduced with ibuprofen. It's also, it masks pain a little, right? So it might just be masking something that you're used to feeling.
Yeah.
And if it worked for you, I would say great. Try it again, because really you just need, the more experiences you have without pain, the less guarding you're going to have. And then that'll lead to less pain over time. But that's not a common one, no.
Okay. Thank you for answering that. And then we had another comment that was when you were talking about playing a game, someone was mentioning their love language, like, well, maybe it's not, playing a game, but maybe it's like we do massages, or, we cook with each other, or we do the laundry together, or something like that. And I thought that was really neat. I wanted your thoughts on that.
Yeah, I love that. I mean, honestly, if it brings you intimately together, then that's great. I hear people tell me that, yeah, we've been doing the laundry together. That's an interesting one. I can't say, that's hard for me to fathom, but I love that you love doing that with your partner. Yeah, massages or something, or cooking together, that's like a really sweet, intimate moment. But just making sure that there's still, and massage is touch, but if you're only doing the cooking, and there's not necessarily like you're holding them from behind while they're cooking, the intimate touch is also important. So people it's the fear of touching, because the touching is what leads to the sex, right? So I would say keep that on the table, and maybe try to introduce some of this other more physical, tactile intimacy as well. Yeah,
I love that. I'll give the chat, I'll give y'all about a minute left to ask any last minute questions that you have. But I kind of wanted to talk about how hormonal therapies used in cancer treatment affect libido and sexual function. I know we have a couple men on here that are taking hormonal therapies and women as well. So I just wanted to ask that question before we left today.
How hormonal therapy can impact sexual function?
Yeah, or libido, yeah.
Right. Well, I mean, so yeah, a lot of people with prostate cancer, for example, they're going to be on an anti-testosterone medication, and yeah, that makes it much more difficult to have libido and erections. I mean, a lot of these women too, people with vulvas, they're after menopause, a lot of them are taking testosterone in order to boost their libido. So, and then estrogen, that's the whole issue, right? So all of these things reduce estrogen in your body, which reduces libido. Unfortunately, and it less so than testosterone, though. Testosterone reduction is really, that's a big one. And
Okay.
so what you do if you have to take these treatments is you know that that spontaneous desire isn't going to be there in the same way, and then you do all these other things to try, not necessarily to get that like super hot feeling you had when you were 30, but to maintain some sort of connection with your partners in order to, and you might find that there's other things that are pleasurable, but not necessarily super arousing, you know?
Yeah. Okay, I'm gonna do one more question from the chat, and it's about the estrogen creams. So we're asking, do we need to use an applicator or can we just use our finger? And the kind of thought process behind that is that maybe you're using both an estrogen cream and a reverse concurrently. So trying to just get less exposure to your body.
What was that last thing you said? Estrogen cream and what?
And like the reverse, like trying to, or reverie concurrently. Sorry.
Oh,
Sorry.
okay. Yeah. So I would use it as prescribed by the gynecologist. Usually it's like 1 gram per application. You don't want to get more than that, you know, so it's half or 1 gram per application. And you can use the applicator to put it in, but then I would just do that right before, like while you're laying down for sleeping, because it comes out, you know, so then you're laying down, it's not coming out, and it's slowly kind of moving through the vagina. But if you're having the pain on the outside, I would take a little bit extra and rub it around like the clitoris and the internal labia as well, because those areas can get kind of, when they're brittle, there's more rubbing and it becomes less comfortable. The other part of your question, Reverie or a hyaluronic acid product plus estrogen cream, I found most people don't end up needing both, especially if because so here's the thing, estrogen cream, usually a prescription is going to cost you about $30 a month. For most insurances, the Reverie or Replens are also about $30 a month. Most people I've found can do just the estradiol cream or the Reverie, and then add on the daily lubricant, which is like way cheaper.
Okay.
It's not going to hurt you to try all three if you need it.
Yeah, but cost effective wise, you're like choose one or the other and then the lubricant.
Yes.
Okay. Well, that will be our last question of the evening. So I'm going to go ahead and close it out for everyone. Just wanted to thank you again for participating with us today, Erin. Like I said, I learned so much from you, so I'm very thankful that we get to hear from you this evening, and I'm sure all of our participants today agree. Just a reminder, this session was recorded and will be sent out to all registrants in the follow-up emails and will be available on a virtual experience Canvas website. If you have any difficulties getting on Canvas, feel free to reach out to me via email, call, text. I am available for you guys. Don't forget to head over to our discussion post for this week as we open up about what we learned during our session today. If you had any unanswered questions, I'll make sure that you can put that in the discussion post, and I'll make sure that Erin has access to that so that we can get those questions answered for you. Just a reminder, we do have restorative Pilates tomorrow at 9 a.m. We have a workshop this Wednesday talking about self-advocacy and how to stand up for yourself using mindfulness with Dr. Zuniga. It's a really great one. And then on Thursday, we have our yoga workshop at 9:30 in the morning. Next Monday, we'll be talking with the Texas Oncology dietitian about cooking demos. So I'll be sending you guys the grocery list for the weekend. So watch out for that. And like I said, all workshops and Zoom registrations can be found on our Canvas class page or in our weekly check-in emails that you received this morning. So make sure to like our Facebook page, like our Instagram, stay active on Canvas, and we will see you guys throughout the week. So bye, everybody.